In Dallas, Texas, a man does have Ebola, and now dozens of people there are being monitored for signs of the virus after they came into contact with him. As Jackson Prosco reports, officials there are preparing to receive another American patient infected in Africa.
Hazmat crews finally have clearance to do a job that few others will, removing sheets, towels, and personal items used by Ebola patient Thomas Duncan. The family of Duncan's partner remains in quarantine. So do neighbors and those who had immediate contact.
We have us quarantined in this apartment that's highly contaminated, that we have such high risks to contract the virus.
The Centers for Disease Control is on the hunt for dozens of people who may have crossed paths with Duncan while he was contagious.
Bottom line here is that we can stop the spread of Ebola by making sure that contacts are checked every day, and the moment they get sick, isolating them and testing them to see if it's Ebola.
When Duncan first showed up in hospital 1 week ago, he told nurses about his travels to Liberia, but apparently didn't mention he had helped carry a pregnant woman sick with the virus.
Oh, did you wash your hands?
And when Duncan left Liberia, he answered no on a checklist, asking if he had been near anyone with Ebola.
The fact that he knew and he left the country is unpardonable, quite frankly.
Liberian officials are now considering charges, while America prepares to receive more Ebola patients. The latest, a freelance cameraman working for NBC. He's being medevaced to the U.S. on a private plane.
I think obviously he's scared and worried.
It's very hot.
The rest of the crew, including the network's medical correspondent, will remain in quarantine for 21 days after they return as a precaution.
We are self-quarantining ourselves, even going beyond the CDC guidelines.
The U.S. is now increasing its efforts to fight the growing threat of Ebola. The Pentagon announcing today another 600 troops are headed to West Africa. That's on top of 3,000 already deployed to the region. Donna?
Jackson Prosco in Washington, thanks. There is no travel ban to and from African countries affected by Ebola. Medical experts explain why on our website, globalnews.ca.